Hi viewers, I am Dr. Sohail Babar Khan, an Associate Professor of Pediatrics. Welcome to my channel Pediatric Pointers, which is a place for your diagnostic dilemmas in pediatrics. I have brought you another exciting and informative video about diagnosis of clinical problems in children with minimum of investigations. If you haven't, please subscribe to my channel Pediatric Pointers and click the bell icon to keep yourself updated about my forthcoming new videos. Let's straightway move to the video. Conjunctival hemorrhage in children. This adolescent boy presented with this painful red eye after being punched on eye during a brawl. Note the red lesion involving lower lateral half of bulbar conjunctiva of right eye. The main differential diagnosis is conjunctival or subconjunctival hemorrhage. It is consistent with subconjunctival hemorrhage because posterior margin of lesion is not visible. In conjunctival hemorrhage, posterior margin of lesion is visible. This case emphasizes the scheme that should be adopted to arrive at the correct diagnosis. History gives clues to possible diagnosis with one or two characteristic features clinching the diagnosis. Don't fall for obvious diagnosis, especially in a very sick patient. This case also emphasizes that history and examination is sufficient in most cases in arriving at the correct diagnosis. Investigations are only required to confirm the clinical diagnosis or know extent of involvement. An astute physician has a diagnosis as soon as the patient walks into the consultation room. This ability is hammered in by using common sense and good observation and gaining adequate exposure and knowledge. Good observation includes good use of all senses: sight, smell, hearing, and touch. It is rightly said that most of us are seeing, not observing. Observing is seeing plus interpretation. Observation is the most important tool of assessment in pediatrics. It also aptly said that common sense is not common. Whenever confronted with an illness, think of common causes, and even in unusual presentations, think of common causes because rare diseases are rare and rarely diagnosed. In every presentation, think of worst case scenario and don't be misled by seemingly minorness of illness. Always first rule out life-threatening or organ-threatening illness. In this respect, quick look test to ascertain whether patient is well looking or sick looking is helpful. In sick looking patients, rule out life threatening or organ threatening illness by all means despite the minoreness of presentation.